Transference is the psychological term for when you project your feelings about someone from your past onto someone in the present. For example, Jamie's father was very critical, controlling, and physically abusive. As an adult, Jamie started a new job and immediately noticed his manager was physically very similar to his father: slim, greying hair, a full beard, and in his mid-50s. He immediately took a very strong dislike to his manager. During our first meeting, Jamie's hands were trembling, he felt scared and stumbled over his words. This is an example of negative transference. Jamie was projecting his negative thoughts and feelings about his father onto his manager. His relationship with his father had formed an unconscious template in his mind which said, older males in authority with a beard and slim frame are cruel, critical and controlling. Jamie's unconscious template fit the relationship with his manager. The influence of the template was so strong and pervasive, Jamie expected his manager to also be critical and cruel, just like his father. The concept of transference was first developed by the psychoanalyst Sigmund Freud. He believed transference falls into three categories: negative transference, positive transference, and erotic transference. Let's have a look at positive transference. Rachel grew up with a warm, loving and attentive mother. Her mother was a nurse and always took great care to provide nutritious food, a safe home and lots of physical and emotional affection. Upon entering psychological therapy as an adult, Rachel immediately experienced her female therapist with great affection and trust. In fact, Rachel viewed her therapist in a very similar manner to her mother. Rachel had an unconscious template in her mind which said older females in the caring profession are good and trustworthy people. However, this template remained repressed and unconscious despite being triggered on her first encounter with her therapist. Both Jamie and Rachel's transference is a repetition of their past. Freud called this repetition compulsion. It's basically when a person repeats a pattern of behaviour from an earlier stage of life. So repetition compulsion is usually unconscious. And one of the primary laws of the unconscious is that which is repressed seeks expression. Let's take a look at erotic transference. Frank felt ignored, mistreated and misunderstood all of his life. He attended psychological therapy to address childhood neglect and difficulties forming romantic relationships. With his therapist, he encountered such a genuine concern for his well-being, it made him feel very special. After a few weeks of therapy, he started to have fantasies about being in a relationship with his therapist. Having never experienced positive feelings of being cared for, Frank redirected his desires and fantasies towards his therapist. Erotic transference isn't always about sexual feelings, but rather the fantasy of merging and being engulfed in the parent-child symbiotic relationship. Frank is imagining his therapist is a loving other he's never experienced, as he's unconsciously trying to create a happy ending to an old, painful situation. Freud originally described transference as occurring within the psychological relationship, but it can occur with anyone: neighbours, friends, co-workers and strangers. Within the context of psychological therapy, Freud believed it's important to draw attention to and interpret the transference, which can help the client break the pattern. Freud believed that otherwise the client is doomed to compulsively repeat until the repression can be brought into consciousness. If you'd like to learn more about repression and the unconscious mind, click on the video on the screen now, and I look forward to seeing you soon.